Today we have Ken Dorst with us. He had a cholesteatoma. It's a middle ear tumor, and the goal of this podcast is to raise awareness of this disease and its progression and ultimately the treatment of it. So how are you?
Doing fine. How are you, Eric?
I'm good. So my first question is, why is it important to the public to be aware of this disorder?
Well, this disorder affects the middle ear, like you mentioned, and in the ear, there are lots of things that we take for granted. For example, our balance and our hearing. And come to find out, in my case, the sense of taste was affected by this. And so allowing a fairly simple problem to exist for a long time in the middle ear can create these problems for you that will last a lifetime. So with just some simple procedures and a diagnosis and a visit to the doctor, you can determine if you might have this problem. And the problem develops from pretty common events like an infection that you might have, or allergies, or that type of thing that would affect your hearing. So if you have those types of problems, it's worth checking with the doctor because, again, a simple procedure and a little bit of time off can fix a problem that's going to affect you for the rest of your life. Because right now, for example, I continue to have problems with my balance, and it's hard for me to navigate through the house and at night because I depend heavily on my eyes since my middle ear has been affected and damaged by this cholesteatoma that I've had. So that's much important to know what you have and treat it.
So there's a lot of research behind the development of cholesteatoma. So the first large-scale study on the link between chronic rhinosinusitis and middle ear cholesteatoma was conducted using the National Health Insurance Research Database in Taiwan. They discovered new epidemiological evidence that indicated a prospective link that chronic rhinosinusitis increases one's risk of developing cholesteatoma. And another study conducted in Romania explored what the cause of this condition is attributed to. Although there are many proposed mechanisms, it still remains unknown. The commonly accepted theory is that blockage of the eustachian tubes through pressure differential that allows for the development of cholesteatoma. So my question for you is, did you have a history of ear infections and inflammation that contributed to the development of your cholesteatoma?
I did. And about 12 years ago, I had my ear rupture. I was at home and asleep, and then I woke up and realized that I had blood actually on my pillow from my ear. And so I went to the doctor and come to find out that I had a very extreme and aggravated situation in my ear. So this infection had finally grown to the point that it burst the ear. And so the doctor that I went and visited felt that it could be treated through antibiotic and steroids. So I took those and hoping that it would subside. But to come and find out, there's really no place for the cholesteatoma to go once it's developed. It just continues to grow and expand. And so it's eaten away at the bone. And so that was a problem that I had and noticed. And then as a child, I had allergies very severely. And so the sneezing and the swelling coming from the allergies, I'm sure, aggravated the eustachian tubes, causing it not to drain, at least on my left side, which that's the side that had the cholesteatoma in it. And then I also noticed as I was flying, from time to time my ear wouldn't pop, and so it was also indicating I had a problem. But of course, looking back, I understand what it was doing. But at the time, I just found it was just kind of either aggravating or strange it was doing that. So my medical history, I would say, would fit what these studies have shown.
A case study of lipomas, which are benign tumors made up of fat, showed that on rare occasions they occur in the middle ear. These tumors may then cause other issues within the middle ear, or they may be mistaken for cholesteatomas. Did you think your cholesteatoma was something else at any point, or did doctors mistake it for anything else?
No, they identified it fairly well. I had a CAT scan done about, 10 years ago when I had the first occurrence, and so the doctor had indicated it looked like it was probably cholesteatoma. And then furthermore, although a somewhat unusual disease, I did notice in both cases at the ENT's office that they had a poster describing the inner ear structure and then common problems that occur with that. And the cholesteatomas on the poster is something that occurs, and so he'd identified because I guess it's something to see relatively frequently. And I've done some research on my side, and it looks like maybe 1 in 10,000 people actually have this occur. But again, as a specialist, they probably see quite a few cases, and so this is a pretty common event for them. So they probably diagnosed it as this problem.
This is another study that's conducted, examined preoperative tests to see if middle ear pathology such as cholesteatomas impact the inner ear. Before surgical intervention, the idea was to impact surgical strategies and provide more information about patient inspection of their postoperative condition and counseling for that. So both non-invasive methods of testing were done successfully to properly evaluate the vestibular apparatus in the study. So what did you know about your postoperative condition prior to having a surgery?
Well, prior to the surgery that I had another CAT scan, and so I visited the doctor here. The doctor looked at the CAT scan, and so he was able to go through it and describe to me the issues that were going on. So he showed me the right side of my head, which is normal, the left side affected by the cholesteatoma. And so that the mastoid cells have been basically taken over by this cell growth. And then also he looked at it and looked like the labyrinth of where the balance occurs had been affected by it. They would be able to tell once they're in and see it, but in fact, I can find out it had been. So 2 of the 3 tubes there that affect the balance in my left ear were destroyed by this. It also affected and eroded the base of my skull to a great degree. So I was, again, another reason to have this treated. I was subject to being affected by encephalitis or any type of brain swelling had I got any infection in this area, because essentially the bone was gone that would protect the brain. So it could be very serious in my case. The doctors also mentioned, of course, I might lose the sense of taste on the left side, also maybe the ability to move or have expression on the left side of my face. So there were some pretty severe problems. And then, of course, the secondary thing they worry about is hearing when they're working with this, because hearing, although very important to us, is not too important when it comes to basically saving a life. So they ended up removing my ear bones as well as part of the surgery. So I'll go back, as is common, about 6 months later. So they'll treat my loss of hearing by installing actually prosthetic ear bones. So all in all, they described pretty well the situation I was facing, as well as the outcome. I just had hoped I wasn't going to lose my sense of taste, but I actually have on the left side of my tongue. And then my balance, it has been impaired, and it's getting better, but it's nowhere near the balance I had before. And so hopefully over time, I'll gain my balance back.
On a related note, a group of researchers from Utrecht Medical Center in the Netherlands suggested that the preoperative condition of the malleus was the most important predictor of postoperative hearing outcomes. What condition were your obstacles in prior to surgery, and how did surgery change your hearing?
I had fairly good hearing. They conducted hearing tests before I went into surgery, and so the hearing test before surgery indicated I had around 70% of my hearing. Immediately following surgery, my hearing is basically zero. And of course, with removal of those bones, the cholesteatoma had wrapped around the ossicle bones, and so those bones had demineralized by the cell growth that was going on, so they were greatly damaged, and furthermore so involved in the cell growth that they had to be removed. So anyway, the study, I'd say, yeah, that would be pretty accurate. And then also furthermore, I lost my conductive hearing. And so again, because of those cells that wrapped around and involved those bones, so they're unable to function as they should have in a normal hearing situation. And as a side note, as a symptom of that, I noticed that speakers sounded like they're crackling. My phone sounded like it was crackling. So even had a bad speaker. So if anyone was wondering if they had this type of problem, if your hearing sounds like a bad AM radio speaker, then you may have a problem involving your middle ear.
A study done in a hospital examined if cholesteatomas acquired by the patient would cause differences in the contralateral ear. There was strong evidence to suggest that there is a greater instance of contralateral abnormalities in cholesteatoma cases. So how was hearing affected in your other ear by the presence of your cholesteatoma?
Nothing is affected at all. As I get older, I imagine my hearing's declining a little bit just naturally, but as far as the infection rate on my right ear from my left that was involved with this, I don't think there's been any crossover or impairment of it.
A study done at the University of Cologne in Germany looked at chronic inflammation in the middle ear's effect on taste. The results suggest that there is a change in ability to taste that goes unnoticed before surgery. Do you believe your gustation had changed prior to surgery or after?
I believe it changed after surgery. Before, I don't think so. I enjoy cooking outside and spicy foods and that type of thing, so I think I had a full taste of all of that, but I definitely know after surgery I have that taste in my mouth that's often described as metallic taste, or essentially a lack of being able to taste anything as a result of the surgery. And the doctors did note that they had to sacrifice my taste on the left side to be sure that they cleaned out, took care of the cholesteatoma and that I had during the mastodectomy. So yes, definitely a dramatic change in my ability to taste post-surgery.
Thank you so much for having you with us today. Again, this is a public outreach project, so hopefully people who hear this are now aware of the seriousness of this fairly uncommon disease, and maybe they'll be able to have surgery earlier than you did so they don't have to sacrifice the gestation or have any struggles with their balance. So again, thank you so much. It's been great, and have a great day.
Well, thank you for your time.